Hi, this is for nursing beginners, and here I would like to explain something in very simple way regarding fever. Fever is a simple and common term because all of us have been experienced at least once in their life. But sometimes it might be complicated due to various reasons. So, in case of fever, what mechanism is going on our body and which system mostly will be affected? These all things we can see also nursing care and nursing care plans too. Then what is fever? Fever is elevation of body temperature due to break in thermoregulation in the human body. First is elevation of body temperature. It means increasing body temperature and due to because of what? Because of break in thermoregulation. What is thermoregulation? Our body already set at a particular temperature, that 36.9 to 37. This is our normal body temperature. Our body is set. Okay, these settings are there in hypothalamus, which is situating in the base of the brain. So these all things happening in the hypothalamus. Elevation of body temperature due to break in thermoregulation. If there is any imbalance happening there, and these all things will be altered, and maybe temperature will be high or temperature will be low. Temperature will be low, it means hypothermia. It will be high, it means fever. So this is the thing happening during fever. And what are the reasons, causes? There are lots of reasons. Many reasons: infection, illness, trauma, any vigorous activities, due to any other medications. But the emphasizing point is infection. How we are getting fever from an infection? So we have to identify how we are getting fever from an infection. So we have to find out. This is the pathophysiology. Pathophysiology, it means when a foreign body, we are telling about infection. Infection means some foreign body will enter in our body that will make infection. So when a foreign body enters our body and this will try to attack, that time WBC will be realizing white blood cells. This is one of the major blood cells in our body. This WBC, they are having full power to protect us from infection. So these are realizing somebody entered in our body, they have to find out and they have to attack. So finally they will start to engulf that bacteria or virus. Engulfing means they are going to swallow. While swallowing, they want to release cytokines. This some kind of protein, we can say mediator. Okay, these cytokines will run to hypothalamus and they will knock hypothalamus. From there, prostaglandin will come out and they are recognizing something is happening in our body and they have to do action immediately. So finally they will increase our temperature. Why they are increasing means, with normal human body temperature, this foreign body will be sustainable. So because of increasing temperature, this foreign body will be destroyed. This is the concept happening here. Okay, then next we can see what are the clinical features. What are the clinical features? So all of us have been experienced, so we can recognize the clinical features easily. Of course, from the definition we can understand elevation of body temperature. Elevation of body temperature means hypothermia than normal, that is 6.9 or 37. Above that we are telling fever. Okay, next sweating, and because of fever we are feeling nausea, vomiting and poor intake, dehydration and generalized body ache and inactivity. These all things are happening. Okay, and next, diagnostic evaluation. How to find out we are having fever? Of course, temperature checking. Is that right? Yes. History collection and physical examination both are must in this, and through history collection we are identifying what might be the reasons and how long that patient have been suffering from this fever, and these all things we are getting from history collection. What symptoms are there along with this fever, and in case of physical examination from head to foot assessment we are doing, so we can identify what symptoms, how much it's severe, and what treatment we are going to give. These all things we can identify through this physical examination. Next, lab investigation. Of course, WBC will be changed because of this mechanism. And next, X-ray. They will recommend X-ray because they have to find out which infection. This infection, maybe they have lots of infection, and so which infection we have to find out. So they will recommend for X-ray also. And next, management. Management we can divide medical management, nursing management, and this medical management, definitely we are giving antibiotics, means paracetamol, and this 4 to 6 hourly we can administer, and we can give tepid sponge, and tepid sponge, this we are keeping ice packs. Before it was ice packs, now they are using warm packs. They are keeping on forehead, axilla, groin. So the body will try to maintain temperature from outside and inside. So when we are keeping outside warm temperature, the body want to maintain the same temperature what we are keeping outside. So they will try to reduce temperature by them itself. And so this groin, axilla, forehead, they have more blood supply, and they so this is more suitable areas for tepid sponge. And next we will assess for dehydration, and for that we will start IV fluid according to the patient condition. Okay, so we have to check height, weight, vitals. Vitals, of course, heart rate, RR will be high because of this temperature. And level of consciousness. In case of severe fever, there is a chance to get febrile seizures because seizure convulsion. And so we have to assess the level of consciousness, and we have to assess the intake output, and these all things are the normal assessment for common type of fever. And finally, nursing care. Nursing care, nurses are doing these all things and assess the patient condition, assess the vital signs, and providing tepid sponge, assess level of consciousness, maintain intake output chart, and assess the dehydration status, and administer IV fluid as per doctor's order, administer antipyretics as per doctor's order, and these all things are doing by nurses. And next, what nursing care plan? Nursing care plan we can simply made from clinical manifestations which were already discussed. Clinical manifestations are increased body temperature. So from that we can make first care plan, hyperthermia, increased body temperature. The term is hyperthermia related to infection. What infection? You can mention that, underlying causes. Hyperthermia related to infection. The second thing is nausea, vomiting. Of course, that patient cannot take orally well. Their nutritional status will be imbalanced. So, imbalanced nutritional status related to poor intake. And next one is they have pain, body pain or headache, something. And there we can mention acute pain related to fever or hyperthermia. That also good. And next one, because of pain they are not able to walk properly, so activity intolerance related to pain. These all things we can find out from the clinical manifestations. Okay, thank you so much.